Gelastic seizures, ecstatic seizures, and orgasmic seizures. Believe it or not, this is actually shit that really, 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 honestly, I swear to God, this shit, it genuinely exists. And it's one of those things that actually it's three of those things that I can't stop laughing about every time I do and dig more information and research into it. I keep just giggling nonstop. Of course, I'm like a 15-year-old boy at heart, or maybe 10, I'm not sure, but it's fucking hilarious regardless. So there's we'll start with some of the funnier shit like gelastic seizures or gelastic epilepsy, for example. It's a laughing seizures. They've been historically related to children specifically. Laughing seizures involve repetitive vocalization. It's often associated with smiling. It's often epileptic syndrome accompanied by precocious puberty and, and behavioral problems, especially aggressive behavior. The term gelastic epilepsy, by the way, it's from the Greek word gelos. It means laughter to emphasize the main character of the seizures. The possibility of sudden emotion as a manifestation of an epileptic seizure has been recognized since about the end of the 19th century. So it's not exactly new information. It's been around for quite a while. So this is just something I kind of stumbled over and I thought it was fucking hilarious. Gelastic seizures are characterized by a recurrent bouts of unprovoked and stereotyped laughter. Okay, it means that for no reason whatsoever, people just start laughing uncontrollably. They can also start crying. They can lose muscle tone, and then they can collapse, fall, like an atonic seizure for example. Uh, so there's I suppose goods and bads to this side of it. It also, you can end up with lightheadedness and blurring of vision and loss of consciousness, which is, of course, something that none of us want any more than we normally have. But it only lasts for about a few seconds. So it's just one of those things that it's difficult to identify. Gelastic seizures are more common, by the way. They're more common in the frontal and temporal lobes, and rarely in the parietal lobe. So this kind of falls in temporal lobe epilepsy group of people. By the way, just so everybody knows, for those of you who are watching. So a report of three adults, a report of three adult patients who had gelastic epilepsy defined as the presence of seizures with a prominent laugh component, including brain imaging, various types of EEGs, brain scans, and medical surgical outcomes. Two patients were classified as having refractory epilepsy. The third patient had no lesions whatsoever on the MRI and had complete control with carbamazepine. I'm sure a lot of people here are familiar with what carbamazepine is, but lesional patients underwent surgery, one with complete seizure control and the other one with a rather poor outcome. So there are certain types of brain tumors that should always be ruled out in patients with gelastic epilepsy. Laughing seizures can also arise from frontal and temporal lobe growths, which can be surgically removed. So we can have these particular types of situations can also be as a result of, but not specifically because of. That's really what it is. And if they find that there is a growth in the brain, they'll remove it, and therefore the gelastic epilepsy or the gelastic seizures will no longer happen. Epilepsies, excuse me. Emotional epilepsies. Yeah, I'll get there. So I'm going to go over some case studies. There's a 35-year-old man with a history of larval cysts, which enclose sacs in the immature stage of a parasite, pork tapeworms, and was treated with antiparasitic drugs as a teenager. This is somebody who probably lived on a farm and lived primarily off of pork sustenance and pork stuff, so he got exposed to a lot of tapeworms. And as a result of it, on top of the fact that he already had epilepsy, he had this infection as a result of being exposed to tapeworms. So since the age of 29 years, he had almost daily spells characterized by sudden unmotivated motivated laughter attacks, which were described by his relatives since the patient was obviously not aware what the hell was going on. In addition, he had occasional seizures which started with forced head versions towards the right. This is my right, by the way, not yours. This is mine. followed by right upper and lower limb jerks, and finally secondary generalization. He received various anti-epileptic drugs, AEDs, with poor response. So he took a lot of different things and it didn't respond very well because that's not what was wrong with him. And he ended up having a bunch of different brain scans that resulted in surgery. Typical. Is it? That's pretty typical, right? So the patient has been seizure free since the surgery, 5 years of follow-up, and under no medication for the past 3 years. So this specific patient who had gelastic epilepsy and gelastic outbursts was also exposed to a specific type of environment. And when they removed a specific portion of his brain, he no longer had these fits or outbursts. And I'm not saying that seizures are fits. I'm just saying in this specific case, they were classified as fits and outbursts. Okay, everybody clear on that? So a 42-year-old man, also who had no relevant medical history whatsoever, at 15 years old, he experienced brief laughter attacks, is what they called them, apparently unmotivated, that was perceived as strange behavior by his family. I imagine they would, but in this group, it's probably more of a norm than anything else. So gelastic epilepsy was diagnosed, and the patient was placed on carbamazepine again. The treatment was stopped after a seizure-free period of 6 years. So after 6 years, he stopped taking carbamazepine. 5 years after he stopped taking it, he started having episodes of unmotivated laughter for no reason whatsoever. He just, the episodes began to recur. He started having the exact same things happen again because his body finally got off the carbamazepine. So his EEGs and his brain MRIs were actually normal, which is kind of weird. So they started giving him carbamazepine again, and the complete control of the spells except during a few poor adherence periods, which means he probably wasn't taking them exactly at the right times. So that's what that means. Either that or his diet didn't allow him to absorb. It didn't allow him to absorb specific types of the medication that he was taking. Was pretty much it. Gelastic seizures are seen in less than 1% of epilepsy. Usually these seizures begin with they begin during infancy and even during the neonatal period with a progressive course, which may include other focal generalized seizures. In patients who have gelastic seizures without impairment or consciousness or impairment of consciousness, laughter is described as unmotivated or emotion-free, which could be interpreted as a disassociation between the motor and emotional components of laughter, although the physiological basis of joy and laughter they're not fully understood quite yet. They're still doing a lot of research on it. So gelastic epilepsy covers how we suddenly get into these fits of hysterical laughter with no reason. And I know that I have fallen prey to that, or I've fallen into that particular pattern before in my life, but I've always tried to find a reason for it and found comedy as a way to explain the reasons as to why I'm having these particular episodes, because I just thought this was really funny. I thought this was really funny. Granted, I spent most of my life trying to explain away why it wasn't epilepsy, because it was never suspected in the first place, but it was just, this is the way I am. So this actually makes a hell of a lot of sense to me personally. And in this particular group that focuses on trying to have a sense of humor regarding what it is that's wrong with us in the first fucking place, this actually makes a tremendous amount of fucking sense. It really does. I have the ability somewhere in my body to turn trauma into humor, and then it subconsciously turns into laughter. And then I try to work out how it is that I'm dealing with it. It's been subconscious. It's not a conscious thing. It's just how I am. So that's gelastic epilepsy. So we're going to move on to another topic that I found quite hilarious. It's called ecstatic epileptic seizures. These are fucking great. You'll love these. And I'm sure that a number of people here are probably actually going to understand this and they're going to be like, wait, those exist? Holy shit. Why? Sign me up right now. If I'm gonna end up with fucking seizures and I have epilepsy and I'm gonna end up with seizures, I have a list of ones that I'm gonna prefer to go down. I've got a couple right now for you that are definitely going to be on that list. So ecstatic epileptic seizures, they're very rare, but as we've covered in pretty much every other show that we've produced so far, everything's fucking rare with epilepsy and seizures. Yes? Everybody agree with that? Everything's rare. So if everything's rare, then this is a possibility for every single one of us. So ecstatic epileptic seizures are rare but compelling epileptic entities. During the first seconds of these seizures, in the aura period, I suppose, is what would be classified as. Ecstatic auras, yeah, there we go, provoke feelings of well-being. I don't know about you, but I've never really quite felt that way. Intense serenity, bliss, and enhanced self-awareness. I have, however, felt that way after eating a lot of mushrooms. Yeah, I'm just going to say it. Fuck it, I'm in Florida. Mushrooms. Anything that opens the consciousness makes me feel that particular way. And of course, it includes laughter. So there's a sense of ecstasy that comes with it. And I'm not specifically talking about the drug ecstasy. I'm talking about the emotion or the feeling of ecstasy. They're associated with the impression of time dilation, and they can be described as a mystic experience by some patients. During recent years, several patients, and I mean recent years, within the last 10 to 12 years, that kind of recent years. Within the recent years, several patients presenting ecstatic auras have been reported. A few of them in the setting of pre-surgical evaluation, including electrical brain stimulation. So they attached electrodes to their brains, and they stimulated their brains, and they said, what kind of readings are we going to get with them? According to the recently recognized functions of the area that separates the frontal and parietal lobes of the temporal lobe, and the results of nuclear brain imaging, MRIs, EEGs, etc., and electrical stimulation, the ecstatic symptoms in these patients seem to be around certain regions of the brain, which is where they found our funny bone, so to speak. That's they after looking at our brains and the neural activity that we have, and especially the excessive amount of it, they actually discovered the funny bone, technically speaking. So here's some signs that you may be actually experiencing or having an ecstatic aura, okay? In case you don't know and you're trying to figure out, am I having a seizure, but I don't feel like I'm having a seizure because this feels too good. If I feel good, it can't be a seizure because seizures are all bad, right? We're all negative and horrible and it's terrible and we feel like the world is falling in on us. But it's not always that way, okay? It's not. And the more information we have, the better. So in this particular situation, here's some examples. Ecstatic epileptic seizures are described as an overwhelmingly positive experience by the people who actually have them. Patients have trouble finding the appropriate words, and sometimes they give simplified descriptions, for example, like bubbles rising in my head, the feeling of warmth over my whole body, things like that. The interested epileptologist, if you have an actual epileptologist, somebody who's really, really curious about your case, in order to not miss these rare cases, needs to actively ask for key symptoms in the patient. So there's a big, huge communication thing going on. Excuse me. Patients' descriptions of seizures with strong emotional disturbances depend to a large extent on the patient's power of introspection, intelligence, and vocabulary. The fearful apprehension of the imminent complex focal or secondary generalized TC or tonic-clonic grand mal seizures can intermingle with the bliss of the ecstatic aura after the first seizure. Such personal feelings as the hallucination of emotion can seem so abnormal that patients are often reluctant to communicate them, which is really not that surprising, is it? Overall frequency of ecstatic seizures is therefore probably underestimated, and historical documentation remains scarce. As a matter of fact, Russian novelist Fyodor Dostoevsky was the his testimony specifically can be considered the very first description of ecstatic auras in literature. Moreover, the existence of ecstatic seizures was initially even denied by some leading epileptologists even as recently as 2006. Ecstatic seizures belong to, by the way, the group of focal epilepsies. I'm sure that the people who have done a lot of research and the people who are looking into the different types of epilepsy and the different types of seizures that we all endure, they'll understand that this is a specific group or type of seizures. So ecstatic seizures belong to focal epilepsies, which of which origin is limited to regions of one particular hemisphere of the brain. Consciousness is preserved during the ecstatic aura, which means we actually stay awake. So we're aware that we're having it. We know that we're actually having the seizure and we can feel it, but we don't lose consciousness, and we don't necessarily lose capabilities or functionality with our bodies. It's generally the kind of thing that other people aren't even aware of. They can't tell that we're going through it at the time. So they may just see us sit there with a shit-eating grin on our face, or a shit-eating grin on their face and a big smile, and go, well, they're really happy, so everything's fine, but they can't tell that we're actually going through it. So the observer is very rarely, if ever, aware that we're actually going through this. So epileptic seizures, they're incredibly dynamic phenomenon. And as in other focal epilepsies and in other focal seizures, after the aura, the seizure can evolve into impairment of consciousness, sometimes with oral or things like facial grimacing and fumbling movements of the fingers, walking, running, resisting restraint. Automatic behavior in a given patient tends to be similar from seizure to seizure. So that means that if we have a seizure specific to us, and once again, we're all very incredibly unique creatures. We epileptic patients, people with epilepsy, people who have seizures as a result of having epilepsy, I don't care how you quantify it, I don't care how you verbalize it, we have epilepsy. As a result of it, we have seizures. Now, we're all different, but we all have something in common. We all have epilepsy. The semantics behind the words that we use is annoying as fuck, because more people spend more time on arguing which terminology and verbiage we use to describe the fact that we're fucked up. It's annoying. It's really annoying. So the seizures, these particular ecstatic seizures, they tend to usually end with a period of postictal confusion, disorientation, lethargy, and sometimes in the extreme versions, they'll go to full tonic-clonic grand mal seizures. Okay, so it feels good. It feels good. Yay, I'm great. Everything's fucking hunky-dory. I feel like I'm coming in my pants. Holy shit, I'm coming in my pants. Oh my God, I'm on the floor. Why are there paramedics pumping on my chest? That can happen in an ecstatic seizure. I think that the biggest deal is being aware of the different types of seizures that we have. And these particular seizures, ecstatics, fall into the temporal lobe region of the brain. And as a result of me having left temporal lobe epilepsy, at least that was the one thing they diagnosed me with. I'm not sure how many other ones I probably have, but I'm fairly confident that it's more than one. I've never been a simple case of anything. It's just not my style. So they define ecstatic seizures as seizures fulfilling the following criteria. These are the things that medically they say, this is what you must go through if you're going to fall into ecstatic seizures. The feeling of intense positive emotions, bliss, enhanced physical well-being, heightened self-awareness, or heightened perception of the external world, or like clarity. Like I can feel the grass grow. I can hear the rain talk to me, those kinds of things. I'm feeling that there are people all over the world right now going, holy shit, I know exactly what he means. If we have epilepsy and we experience these sensations, these are specific to us. That means that it's more than likely a seizure, an ecstatic seizure that we just didn't know that we were having. Other people get a kick out of music that they listen to. They get a rush out of doing certain things. We get seizures out of them. And in my life, without knowing that I had epilepsy for so long, I excused the experiences that I had as this must be the way everybody else felt, which is unfortunately one of the reasons that I've ended up in so many heartbreaking situations in my life, because I didn't know. And I know I'm not alone in that. So these particular symptoms, they should occur as a primary experiences and should not be caused. Let me start again. These particular symptoms should I'm excited about this information. It actually makes me feel a little better about my own life. These symptoms should occur as primary experiences and should not be caused by other seizure symptoms. So in the research, I've gone through patients' testimony, and I'm going to read a bunch of information regarding different people's experiences regarding ecstatic seizures and see if this information might apply to you. If it's applicable at all, then my recommendation is to go through and start digging further to understand it. So patient number one, and of course I have to move off my mark. Patient number one, intense serenity and bliss. Describes this led to a feeling of complete serenity, total peace, no worries. It felt beautiful. Everything was great. The immense joy that fills me is above physical sensations. It's a feeling of total presence, an absolute integration of myself, a feeling of unbelievable harmony of my whole body and myself with life, with the world, with everything. So patient number two describes it as an enhanced physical well-being. It was something that I have never felt before. It felt as though my body was filling up with a sensation which was quite surreal. The feeling was almost out of this world. A halo, something pleasant which fills my inner body, wrapping me with a rapid crescendo, is a well-being inside of a sensation of velvet, as if I were sheltered from anything negative. I felt light inside, but far from being empty, I feel really present. Something has taken possession of my body. I feel really good. An overactive sense of goodness, I suppose would be a good way to paraphrase that. A heightened sense of self-awareness and or perception of the external world. During the seizure, excuse me, during the seizure, it's as if I were very, very conscious, more aware, and the sensations, everything seems bigger, overwhelming me. I feel rooted to the spot, and a more developed consciousness. I feel a stronger consciousness of the body and the mind, but I do not forget what is around. It affects both the cerebral thought, which is very intense and concentrated on itself, and the physique. Being very conscious of myself, I feel discharged from anything else, although I do not lose consciousness. And that's important to remember. I feel very, very, very present at that time. The consciousness of myself is very increased, rather on a psychic point of view. I am 100% concentrated on myself. I know I have felt this way before, for no reason at all. Just this intense focus that I couldn't explain it. Totally conscious, totally aware, but I know the feeling I was having is different than the way other people felt about it. And again, I think this is something that a lot of people with these types of epilepsies and these particular types of seizures have experienced in their lives, trying to convey a thought, an emotion, a feeling, and it's impossible to get that across. It really is. So there's also like a feeling of dilated time. Escape into time space into the body, for example, like withdraw. It's a moment of fullness and the loopness of time as a return to the self. Entirely wrapped up in bliss, full of radiant sphere without any notion of time and space. Relatives tell me, I'm quoting by the way, my relatives tell me that it lasts 2 to 3 minutes, but for me, the moments are without beginning and without end. The feeling of overload, the physical state and overload, the feeling of intense and sensation of fullness. Give it a second, Chad. It's not me, it's you. I promise. The sensation is certainly more intense than could be achieved with any drug. And that's definitely something I can understand. This feeling became stronger and stronger until it became so strong that it was unbearable and it led to a loss of consciousness, which is the progression of these particular types of seizures. Is we get so overwhelmed by the emotions that our bodies shut down. And yes, there is proof of this. Now, I'm going to touch on this, and everybody here knows exactly how I feel about this, but I'm going to cover it because it's relevant to this particular conversation, and I'm not taking any sides. I'm just going to repeat the information that has been written by a person that has had this experience. I hope that's a good disclaimer. Mystic or a religious experience. Maybe the closest sensation that I know would be an orgasm, but when I felt was not at all sexual. Okay. I have no religious feelings about it, but it was almost definitely religious. These experiences brought me confidence. They confirmed that there is something that surpasses us. It's this big happening in your life to have these seizures. Thanks to these experiences, I do not fear death anymore. I see the world differently. Now, those are quotes from people who've reported ecstatic seizures and epilepsy, the effects of these particular types of seizures while they've had epilepsy. So that makes sense. I'm not quoting directly because I don't believe I've ever felt that way. Not ever. I think I felt bigger. I think I've had seizures that have caused me to believe that I was bigger than the thing that created me. Those are the types of thoughts that I've had. And then, of course, last but not least, and probably most common amongst all of us, is anxiety. Soon after the very first seizures, and anxiety intermingled very rapidly with the bliss sensation. So a patient described anxiety because of the anticipated fear of how he would appear to other people during his complex focal seizures. However, as the bliss increased, it overcame the associated anxiety. So as the seizure progressed, I think this has to do more with people who are naturally quiet. When they feel a surge of energy where they feel like they want to interact with people, I think there's a sense of, I don't want to do that, but it's a part of me and I can't control it. I think that's what that's all about. That's my interpretation. Ecstatic seizures are, above all, extraordinarily emotional experiences. I know that's probably shocking to a lot of you, which in some cases can be life-changing, which would explain going back to the religious experiences. Among the seizure-related experiences of emotion, the large majority are also among the seizure-related experience of emotion, the large majority are unpleasant, such as anxiety and fear and depression, while seizure-related joy is only rarely reported. As in, let's not get our hopes up. These do exist, but that doesn't mean they're actually going to happen to us. I would like to believe that the more information that we have, that we might be able to guide our seizures from time to time if we're really lucky. Ecstatic seizures are dominated by a feeling of conscious self-presence, okay? Characterized by a heightened self-awareness and a feeling of union with the world, the all, so to speak. I'm in tune with everything. I can feel the grass grow. I can smell the air moving. The breakdown of the barrier between the persons and all their surroundings, for example. It's like we all feel in tune with things, but when we're having an ecstatic seizure, because we're epileptics, our sense of awareness to our surroundings is going to be heightened, like excessively. However, our interpretation of other people's expectations of the world are going to be very excessive, and it's going to make it extremely difficult for other people to understand what it is we're trying to convey to them. I think that's a good way to put it. Actually, no, that's how they put it. I just paraphrased it. And last but not least, I definitely saved the best for last, especially for this particular show, because I'm sorry, but you have no idea how difficult this has been to me to do this information and to do this research and bring this information together and try and keep as straight a face as I can, being the person that I am. And I've only touched on some light points of humor. But this last one's a fucking doozy, okay? And I'm hoping that this video, or this particular piece of information in this video, gets passed around to other people so that they can actually have some hope about the types of seizures that we all get. Carrie, join me in discussing orgasmic auras and orgasmic seizures. For the rest of the people that don't know, yes, these really fucking exist. I promise. So for those of us who aren't getting enough nookie at home, we can just hope and pray that our epilepsy can provide our needs. A report published in 2007, for example, on 7 different patients who experienced an orgasmic aura. See, I'm going to have a really hard time getting through this bit. A report published in 2007 on 7 patients who experienced an orgasmic aura at the start of their seizures. The patients, 5 of them women, 2 of them men, were aged 36 to 58. I'm 50, so I'm in the range. 3 of the 7 patients described the exact nature of their auras only many years after they had them, when the epilepsy diagnostic procedure became more intensive due to drug resistance. So they, after years of taking the same drug, they became resistant to it, so they had to go back in and start talking about stuff. Moreover, one patient was refused any new, this is one of my, Carrie, this is your favorite line in this whole thing. Moreover, one particular patient out of the 7 actually refused any new therapeutical options due to the reportedly positive role of the orgasmic aura on her life. I'm going to go over that again. There was one patient out of 7 who said, fuck you, I don't want any more goddamn medication. I don't want any fucking surgery. Don't you dare take out the portion of my brain that makes me come all over myself. Do you understand me, motherfucker? Okay, I don't want your help. I finally got what I came for, or I finally got, yeah, you know what I mean, right? Stop touching my coochie. I like it just the way it is now. Thank you very much. Can somebody please give me an amen? So all of these patients that have orgasmic auras, all of them have temporal lobe epilepsy of some type, okay? All of them. The clinical procedure or the clinical pictures of EEGs, MRIs, and SPECT findings suggest a right temporal epileptic focus in 6 of the patients, while 1 patient, the region was localized in the left temporal lobe. All offer published cases with orgasmic auras suffered from temporal lobe epilepsy. That's right, baby. I can seduce myself. When I say go fuck myself, or somebody tells me to go fuck myself, I can just close my eyes and actually do it. And chances are, according to the other information, I'm going to enjoy it more than if you actually fuck me yourself. I feel like I'm asking my brain out on a Tinder date, for God's sake. I swear to God. It's like, hey, brain, you know, that person over there doesn't like me very much. Do you mind if you just kind of go fuck me yourself? That'd be awesome. Fucking great, man. In the latter case, the left hemisphere, the 1 out of the 7, in the latter case, the left hemisphere was speech dominant. Okay. So while in other cases, and no WADA tests are, by the way, in case you weren't aware, WADA tests are tests that they tell the doctors which side controls the language of your brain. So we're all dominant one way or the other. Yeah, I know. I get to use dominant. So the results confirm that orgasmic auras could be considered a sign of a seizure to the right hemisphere, which has clinical importance in evaluation of epileptic patients. Granted, not many of them want to go in and admit that they jizzed all over themselves and say, I think I might have epilepsy because I nutted in my pants. That's a really weird diagnostic way to look at things, isn't it? So, however, the orgasmic aura has no 100% guaranteed value because the seizure-specific region of one of the patients was located, 1 out of the 7, of course, was located to the left side of the brain and was found to be dominant side by the WADA test. So the left side of the brain they had left temporal lobe epilepsy, and they also used the left side of their brain so that they could communicate and talk. There we go. Yeah, that's a really good way to put it. Until now, only isolated case reports have been published on orgasmic auras. Probably because everybody is really uncomfortable talking about orgasmic auras. Just the term itself is going to conjure up a lot of Karens. So we all know how that is, right? I think we might actually have a possible broadcast point where we could talk about orgasms without getting ourselves in trouble. Oh yeah, we do. We actually have one. This is the broadcast one. So they suspect that most of the epileptic patients who've experienced seizure type orgasms have never reported it, which really isn't surprising. I don't know if people in the group, people in our group have read in the other groups how there was a recent post, somebody mentioned how he was embarrassed because he had gotten an erection and had an orgasm at the point that when he was having a TC, and he felt really embarrassed. And I was very curious about how that could possibly translate. And then I started digging into orgasmic seizures, and there's just a shitload of information about it. It's fascinating stuff. It's really fascinating stuff. But I think we, as creatures of habit, of the way we've been raised throughout the generations, is to have this immediate kind of shun effect, to go, well, this is sex related, so therefore I should keep it to myself. I don't want anybody else to know this. This would include and extend to the doctors that are diagnosing us, because we don't feel it's relevant. It's relevant, okay? It's fucking relevant, or it's relevant about fucking. But it definitely is relevant to epilepsy and seizures. If it can cause us to have a seizure, it's relevant. So please, for the love of God, or the love of, or just please, for the love of fucking, would you talk to your doctors and say, I think I might have woken up in a nut of my own, and I might have been a seizure, because the person that I normally fuck wasn't actually in the room at the time, and I know that there was a nice big pile of goo. I'm 50 years old. I have no reason to be having wet dreams unless something else is wrong. That's actually part of a diagnostic portion of epilepsy and having seizures with people like us. Okay? It's funny. It's laughable. It's self-conscious, but it matters, because we have epilepsy and we're different. So no matter how funny it might be, no matter how awkward it might be, I don't fucking care. You tell the doctor if you've got something like this, because if it leads to, and by the way, it does, it leads to grand mal, tonic-clonic seizures. And while you're lying there in a pool of your own jizz, wishing it was somebody else who made you do it, and you're like, I'm never going to tell anybody because I just brought myself to orgasm and I didn't have to use either a hand or 3 fingers. Tell your fucking doctor. Although we cannot exclude the possibility that seizure-induced orgasms have a different underlying brain mechanism than, say, physical stimulation, for example, it seems reasonable to assume that orgasmic auras are caused by epileptic activation, or the same brain regions which produce physical orgasm. So when you touch somebody, there's something that happens in the brain regardless. It happens to everybody. When you touch somebody's parts, they have a response to it. It's normal. That's just human beings. So they're trying to figure out if there's a connection between the two. Most of the patients describe their seizure orgasms as feelings very similar to one which they experienced during sexual intercourse, getting laid, for example, or jerking off. Okay, so they described, like, you know, I think I had a seizure, but I wasn't jerking off and nobody was sucking my dick. I'm only speaking for the men here. Okay? I wasn't having sex, but I definitely felt like I was getting fucked. I think that's actually the working definition of what a seizure is in the first place. So you feel that way without the reason for feeling that way, and there's no reason to feel that way. That's probably, according to the information and the research, and whether or not they want to admit that it's rare, I think it's a lot less rare and a lot more common than they understand, due to the fact that most people are very self-conscious about sitting on camera or even in front of another person and going, I think I nutted on myself and I might have had an orgasmic seizure. Even with epilepsy, and we're used to talking about shitting and pissing on ourselves, but dear God, let's not talk about our giblets down there and our sexy parts, right? Because that's just bad. Fuck that, man. Tell everybody. No, I'm kidding. Don't tell everybody. That's not going to work out well for anybody. I promise. So yeah, orgasm doesn't require genital stimulation. By the way, it doesn't require it to occur in response to the sole imaginary in the absence of any physical stimulation, stressing the role of its central neural mechanisms, which means that, and the short version here is, we don't actually need to be touched to have an orgasm. We can imagine something that's, and I believe, ladies, this is probably more prevalent among you than it is among men. Men are very physical. Ladies have the ability to imagine or to generate something inside themselves that they're more prone to having some type of physical reaction to the emotional response that they're generating in their own mind. So they can technically, I guess, if you want to put it this way, are able to cause themselves to have orgasms due to the fact that they can have a memory or a specific thought about a certain thing. And fuck you bitches for that shit, by the way. We actually require interaction. Unless we have epilepsy. So, lucky me. It definitely gives a whole new twist to go fuck yourself, doesn't it? So a great deal of data suggests that the right hemisphere plays an important role in human sexual functions. The production of hormones controlling sexual function shows a right-sided predominance. Right-sided epileptic areas of the brain are associated with diminished sexual interest. Sexual arousal is associated with right-sided hemispheric activation. So let me go over this again, because this is something else that we have discussed recently. People on AEDs that are dealing with the side effects of them and wondering if there's something wrong with them as a result of losing sexual appetites, having no desires, like not seeing things in a physically attractive way, a sexually way, okay? Their partners specifically. So the production of hormones controlling sexual functions shows a right-sided predominance. Right-sided epileptic areas of the brain are associated with diminished sexual interest. So are most of the drugs that we take. The AED drugs we have to take to control our epilepsy, control the areas of the brain that where sexual interest occurs. They're designed that way. Apparently, our sexual desires as epileptics, as people with epilepsy, as people who have seizures, is so intense that we need medication to calm it down. But the biggest problem is that the medication calms it down so much that we no longer have any interest in it at all. And I know for a fact, I am not the only person that feels that way. There are so many hilarious points and so many wonderful things to discuss regarding all of these points. It's just a matter of having the information. And I didn't know any of this shit until the last few weeks. You know, I kept thinking there was something wrong with me or something wrong with my relationship. And I've looked at my previous relationships and I even spoke to my ex-wife recently and asked her a very uncomfortable question, but it was specific to my epilepsy and it was a medical thing. It wasn't a, I'm trying to hook up with my ex thing. I talk to her once every 3 years, okay? If she remembered a specific situation or a number of situations where I had like orgasmic seizures, where I ended up on the floor, and she did. It freaked her out. I ended up in the hospital a couple times. We didn't know what was going on, but it was directly related to that level of intensity. And I know that since that time, I have been exceptionally careful about the interactions I've had with other people on a physical level for fear that it was going to happen again. And it has diminished the experiences that I have had because I didn't know what the fuck was going on. And now I know what's going on, and they give me these neat drugs that make me not want to actually have those types of encounters anymore. So I get to live with a fucked up sense of humor and no action from a giblet. I think all of this kind of comes together as the only thing I really have left is a chance to laugh, right? I mean, that's everything I read. It keeps coming back to, they keep tamping me down and saying, you can't be this person anymore. We want you to be, and not condescendingly, but they want to make sure that I don't get any sicker, which is understandable. That's what scientists and doctors are for. But it doesn't include me having a life. Does it? It only includes me staying alive. So I don't know, John. I think it's a matter of trying to understand where it all lies, and knowing the information and realizing it, and going, okay, well, if this is the way it is, then I need to kind of compensate and maybe extend over to the other side. It's not just a denial or the fact of saying I can't do this anymore. It's a matter of saying, how in the fuck is it that I am able, or how will I be able to do it again? I would prefer to look at it that way. That's probably just me, but I doubt it. Find solutions. KY jelly is a solution. You know that, Carrie. So say kick or slick ass, because we've been having a weird conversation. Oh, man. I was a little late this evening, and I have a bit to do before we are done for the evening, as promised. This is going to be a little... Excuse me for a moment. I have to prepare. In honor of our topics and discussion this evening on Gelastic, Ecstatic, and Orgasmic seizures, I give you pie etiquette, the proper and the improper way to eat pie. And ladies, if you're not paying attention, that was definitely an analogy. If your man don't do it like this, he ain't doing it right. So, remember, there's always a proper and improper way to eat pie. The proper way to eat pie. I like to start with the point myself. Oh, nice vanilla ice cream, caramel sauce on top. It's one of my favorites. I don't know about you cats and kittens, but I definitely love cherry pie, especially when the cooler weather months show up. Reminds me of fall and my father. This is his favorite pie in the whole world. Truly wonderful. But remember, you must always dab. Never, never, ever smear. That's just great. So, that was the proper way to eat pie. The improper way to eat pie. Just remember, no matter what you do, dab.